Hey guys, it's Nurse Gwenny. Let's talk about increasing intracranial pressure and Cushing's Triad. Increasing intracranial pressure is when the pressure inside your head starts to increase and we run the risk of herniating our brain because we have the Monroe-Kelly doctrine that states that the space inside your cranial vault is finite. It can't stretch to accommodate swelling like, say, your ankle could if you twisted your ankle. This is my skull. It's nice and hard and it can't expand if I, say, develop a brain bleed or if I bonk my head on something and my brain starts to swell. If one of the three components, your brain matter, is about 80%, your CSF is about 10%, and your blood in your brain is about another 10%. If one of those increases, one of the others must decrease to accommodate for that increase. So when that happens, you're going to see a triad of three things. The first thing you're going to see is widening pulse pressure, which means that your systolic blood pressure comes up and your diastolic blood pressure comes down. And that's a compensatory mechanism, right? Because we know that our cerebral perfusion pressure is simply your MAP, your mean arterial pressure, minus your ICP. So your heart is trying to accommodate and overcome that increasing ICP by increasing your systolic blood pressure to push more blood up into your brain, because we have to keep your old thinker perfused. It does not have any oxygen reserves and it needs a constant steady stream of oxygen. So that's the first thing you're going to see. The next thing you're going to see is bradycardia. And the theory behind why our patients develop bradycardia, it's twofold. Either one, it's directly affecting the medulla where your brain is trying to herniate and thus causing bradycardia, or it's because the baroreceptors in your body are sensing that increasing MAP that your heart tried to perfuse your brain and compensate with, and it dropped your heart rate to make up for the fact that your blood pressure is spiking. The third and final change that you will see as a patient worsens in their increasing intracranial pressure is impaired respiratory rate. And that is because of the direct impact of that impending herniation through that foramen magnum of your brain, sneaking through that big hole in the bottom of your skull, that foramen magnum, and that's pressing on the medulla, which is what controls your respiratory rate. And we will see those Biot's respiration, maybe Cheyne-Stokes, or that guppy breathing pattern that we see in our brain injured patients. So be on the lookout for those. If you happen to notice it, you need to do whatever you can to try to prevent that herniation, because once you do that damage, that is permanent, my friends. So if you carry mannitol or hypertonic saline, they can buy you some time to get your patient to a trauma center with interventional neurology. That's what you can do to buy yourself some time.